Hello, my name is Simon Talbot.
And I'm Wendy Dean.
And we're here today talking about moral injury. We want to talk to you about what it is and what we can do about it.
So back in July of 2018, Simon and I published an article about moral injury to talk about what we believed was the root cause of physician distress that has become such a crisis in the country in the last several years. And what we found was that we ourselves and the friends that we talked to who are in medicine acknowledged that they were really struggling, but they didn't feel that burnout really resonated with them. And so we started talking about a different concept that resonated profoundly. And when we put that concept out in this article, it clearly resonated with the rest of the healthcare community as well. We had over 200,000 downloads in the matter of about 10 months. So it seems that moral injury is really the phrase that people feel gives language to what they're experiencing.
Now, the genesis of some of this discussion was a really disturbing statistic. There are around 44 per 100,000 physician suicides in the US every year. This is around twice the number of suicides in active duty military, and it's significantly higher than the general public's suicide statistic. And it was that number and that disturbing trend that we wanted to focus on.
So the concept of moral injury was developed in the context of Vietnam veterans who were coming back from the war and were being treated for PTSD, but their symptoms weren't getting better as quickly as their clinicians thought they should. And they developed another concept called moral injury. So the definition of moral injury is perpetrating or failing to prevent or learning about an act that transgresses deeply held moral beliefs. So for example, with physicians or with other healthcare providers, we take an oath to take care of our patients first, to always put them as priority. And then there are some situations in which we are unable to do that. We have to take other things into consideration first.
Now, the term burnout has been overused in many different contexts. And as we've gotten deeper into this idea of moral injury, we've found that the term burnout has been used to cover several different categories of physician distress. First, it's often used to talk about physician impairment. That might be a physician who's depressed, it might be a physician who's got a substance use disorder. Second, burnout is used for those physicians who are just under a lot of strain, who have a lot going on. They may have problems at home and a lot of other issues, but that physician's under strain, and that's the physician that does well with wellness retreats or time off work. But the third category, which encompasses many, many physicians, is the category of moral injury, the category where you're trying to take care of your patient, you're trying to take care of your employer, you're trying to take care of yourself, and to some degree take care of the insurance company. And it's these double binds, trying to keep everybody happy while at the same time staying true to your oath to do the best thing you possibly can for the patient, that creates this internal injury, this moral injury that people sustain.
So the other thing that people have asked us repeatedly is, what are the next steps? And we really think there are three. One is to value our physicians, to value the patient-physician relationship, and to make that the priority and the central tenet of healthcare. And the final thing is to rebuild our community of physicians and our community of healthcare professionals, so that we can work together to take care of our patients.
We'd love you to join us. If you go to our website, www.moralinjury.healthcare. You can read other articles we've written, and we'd love to come and speak to you. Thank you.
Thanks.